Well, that's a great point. We do need acutely to do all the public health measures possible to try to keep this virus from spreading to more people and taking more lives. And so the masking and the social distancing and now the vaccines have just been critical. But this is also, as you've just said, a wake-up call to the fact that the state of our nation is not particularly impressive when it comes to our overall health. We have lots of chronic illnesses that make people more susceptible. And certainly the epidemic of obesity in the United States, which has been dramatic over the course of the last 35 years, is one of the reasons why we have seen this virus take such a heavy toll on so many people, because that is one of the highest risks. And of course, obesity also tips over your risk for diabetes and hypertension, which are themselves risks. So yeah, if you wanted evidence that we are kind of sitting ducks for something like this to come along and do even more damage than it otherwise would, well, here it is. So for you as a person who advocates for the whole person to be fit and healthy, this is a bit of a lesson, I suppose, that we all ought to try to learn from. I think I told you earlier, I was somebody in that unfortunate, dissipated state myself 12 years ago. And for me, it was actually the experience of doing some genetic analysis on myself, because I was very much at the forefront of trying to use precision medicine and discovering that I had a lot of risks for diabetes in my DNA that I didn't know, I didn't expect would be there. And it was a wake-up call, and found this personal trainer who now runs a gym, and also corrected my diet, got rid of all those honey buns. Oh, I used to love honey buns. And lost 35 pounds, which I've kept off ever since. And that doesn't mean my health is perfect either, or my health habits are perfect, but it was such an opportunity to actually approach life from a positive perspective instead of sort of feeling like a victim of your own health habits. Hey, take charge. You're going to feel better about yourself if you do. But we as a nation haven't been very good at that. I think our messages to people about health maintenance often sound sort of one size fits all, and maybe that's about somebody else. And our healthcare system really doesn't seem to pay much attention to prevention. It's all about let's treat you once you're already sick, which is upside down from where it should be. So yeah, wake up call, COVID-19 in many ways.
It is a wake up call. And thanks for sharing that. And probably like many of us, once you changed some of those habits, you didn't realize how good you could feel. I think like so many of us walking around, we just feel like, oh, this is normal how I feel every day. And don't realize that just some small changes, you can feel a lot better.
Yeah, now I can deadlift 250 and I can bench press 140, and I'm 71 years old, and it makes me feel pretty good on a 5 o'clock in the morning workout.
That is amazing. Oh my gosh.